Just before we get right into it, I'm just going to say that I'm very fortunate to have, had this project with Dr. McGoldrick. We have shared a class together since, I've been taking Civ in my sophomore year, and I've been very fortunate enough to build a very close relationship with him and discuss my passion for sustainability and global service. So we've always been trying to connect on a trip or connect on some form of project where we can kind of work on this and promote this. In my past semester, senior year fall semester, I took Catholic Social Thought with Dr. McGoldrick, and which was another wonderful class of his where we were able to connect Bible studies to studies of themes like this, like global development and global sustainability. So when he approached me to discuss his work in Ethiopia, I was very, very intrigued. And we had actually planned on the travel, but a few things kind of just fell through the cracks and didn't work out in our favor. And then obviously now we're in an interesting time. But when he asked me to work on continuing the project, I was honored because I would love for this story of Dr. McGoldrick's work and Dr. Mecca's work to be continued. And it's really just important for these PC students to understand how much of an impact Providence College can actually have on the rest of our world. I'll walk through a few slides, and Dr. McGoldrick, feel free to jump in anytime and elaborate on anything that you might want to dive deeper into. So just an overview. The NGO that the late Dr. Mecca at Providence College founded, the Global Sustainable Aid Project, is partnering with Catholic Relief Services on a USAID project in Ethiopia to introduce these microflush toilets. The project began in August of 2019 with the goal of training Ethiopians to build the toilets, to start small businesses, and to provide microfinancing for the households to purchase the toilets. Ethiopia is one of the world's worst countries for sanitation. It has 100 million people at a very high rate of open defecation. So this project is meant to increase food security, recognize the interdependence of sanitation and nutrition. Studying health policy and management, one of the reasons why I wanted to get into this project, because I saw a lot of my perspectives coming into it and working well with the teachings that Dr. McGoldrick was sharing through his theological perspective. So for me, from someone who, like I said, studies healthcare, sanitation is extremely important, and food security and nutrition, these are all different aspects of social determinants of health. And these can really make or break, if you will, the quality of life that someone is going to have. So it's very essential to have food security, sanitation, and ensuring that you have proper nutrition, especially within developing nations. So what is a microflush toilet? As you can see, there's a wonderful picture there to the right of Dr. McGoldrick working with some of the Ethiopian men on creating the toilets there. They're working on the frames and the structures. So the toilet designed by Dr. Mecca can be built with locally sourced materials. It features a microflush valve invented by Dr. Mecca and one of his students, and a mechanical engineer in Ghana. The toilet flushes the water diverted from a sink after hand washing. All waste is collected in a sealed chamber and then composted as fertilizer. Because the toilet is odorless, it can be installed indoors and outdoors. And not only are the toilets very cheap, they eliminate pathogens with the human waste they consume. We can build a household toilet if the family contributes labor and builds its own superstructure for under $200. So this is an affordable way for communities to improve their sanitation, improve their quality of life. And I think the importance there is when the family contributes. So when you have the toilet structures being implemented, it's very important and very essential that the people around are learning how to do it, because you cannot just implement something without having the people around learn how to do the process in itself, because that's not sustainability. That's just implementing something in a form where they may not be able to keep up with that. So it's working together in solidarity on understanding the problem at hand and working together to find that solution. So here we have a little tab called Learning More. So the following video is a video with an interview. Is an interview with Basha Mahmoud, the Dean Director of one of the rural technical schools. He is enthusiastic about other African people coming from Uganda, Kenya, and Ghana to teach them microflush technology, and wants to start building them as a side business himself. So I'm going to click the video, and hopefully that you can all see this. Can you guys hear that? I know the volume is pretty low in the video, but
the volume's not coming through too strongly.
Okay. The interview was low on volume, so if you want to turn your volumes up on your computer, I think mine is up all the way. So I'm just going to play the video and then I can talk about it afterwards. So that video basically stresses the positive impact the toilets have on not only their health, but emphasizes how the toilets provide employment, stimulate education, and help the overall community and the economy. So essentially what Basha is discussing there is how, just essential the toilet is just for many aspects of the community. It's not just something that helps with sanitation. It really stimulates the economy, and it gives the universities another aspect of learning. So it allows these students to learn more on the mechanics around it and how to build it, but also just about sanitation in general. So it's kind of touches upon aspects of public health, aspects of physics, aspects of working to create this new invention that will help them on many fronts. Supporting jobs is extremely important. So that's one thing that he was very fortunate enough to talk about, was that providing this employment and this form of employment is extremely important for the people to have the opportunity to work. So Dr. McGoldrick and I were talking about the challenges that were being faced in this project. Not every project is perfect, so you will see some bumps in the road. And this project has met with some significant challenges since it began in August. Ethnic violence has stopped work on several occasions. Materials are not always easy to find in Ethiopia, which is very poor, and the quality is not up to par. USAID rules for procurement of materials requires 3 bids and takes more than a month. So finally, GSAP had to learn to become part of the CRS system on a project that was about 100 times larger than anything they had done before. So before the pandemic forced us to abandon the project for now, we succeeded in certifying about 12 makers and building 60 demo toilets. GSAP has a strategy for business development with CRS and local community leaders. We have also been developing a plan for microfinancing, teaming up with local agro banks. So with every project, you have to be adaptable, and there are some things that just are unexpected. So especially working in a developing nation, when you have a lack of resources, you want to make sure that what you're providing is going to be sustainable. It's back to that point where, you want to make sure that when you leave, they're going to be able to sustain themselves and work with the resources they have. So that's what the struggles have been currently. So it's really important to, continue to work out the kinks in this time that we have during the pandemic. Well, the work has been pause at the moment. So we're trying to, Dr. McGoldrick, I know, is working very hard on trying to figure out some of these logistics that are going to lead back to, the allocation of resources and so on. What's happening now? So it's important for the communities to understand the concept of sustainability and how to care for the toilets. This requires continuous follow-up. Due to the GSAP staff having to leave quickly due to the countries closing their borders as this pandemic first appeared, we have not started more than one of the 60 toilets so far. The rest have been locked, so people wouldn't start using them and make a mess without the worms that help prevent contamination. That would have been absolutely disastrous for our first goal, which is to introduce the new benefits of this technology. And the rains will arrive in June, and all the work will stop until September. So hopefully we'll be able to return then and make much better progress. So in the meantime, we hope and we pray for the safety of the Ethiopian communities, and we'll work effortlessly towards promoting the importance of this project and the role Providence College plays in providing essential global service. So that's the conclusion of the PowerPoint. But I just want to say again that I'm, very grateful to have worked with Dr. McGoldrick on different aspects of this project, because I continuously am learning more, and I am, someone who likes to continuously educate myself and find how I can apply what I'm learning at Providence College in the many different studies, whether it's, my health policy major, my economics minor, or just other classes that I'm taking, like theology with Dr. McGoldrick. So how can I apply, my learning in my studies to the real world? And, how can I see the world through a different lens? So I thank you for Dr. McGoldrick for, helping me, tie these different aspects of my education together and continuously work on this project with you. And I think that it's very important for Providence College students to understand how they can affect and they can impact these developing nations around the world, and how we can play a large role in providing essential care and essential aspects of life for them. Dr. McGoldrick, do you have anything that you want to add?
Yeah, well, thank you, Paul. That was a nice summary of things. It's really too bad you weren't standing beside me in that photo. That was our plan, wasn't it?
Yeah.
Thanks. Dr. Van Reed also had funded your trip, and we thank you for the center for doing that. And it's just ethnic violence made it unsafe. And because it was around Christmas, everything turned out to be fine and had calmed down, and it would have been, but we just couldn't take the chance, unfortunately. Mm-hmm. But you're welcome to come with me another time, Paul.
Yeah, absolutely. I definitely will keep that in mind. I got a question in the chat saying, what are my plans for the future? I'm actually working in Providence at Blue Cross and Blue Shield of Rhode Island. So I'll be doing that full time. I'm starting May 18th remotely. So I work in the Medicare department and the policy and business planning department, where I work on new interventions and new markets, and how can we provide care for the dual eligible population of Rhode Island. So, I'll be around the area, Dr. McGoldrick, and, I love doing work like this. So it's definitely something I can see, continuing in the future.